Joining us live right now is our good friend, Dr. Joe Congeni at Akron Children's Hospital. Good morning, Joe.
Hey, Ray. How are you today?
I'm doing great. What do you have for us today?
Good. You're not letting this weather get you down. I know that. You're an upbeat guy all the time, and so you're hanging in there?
Yeah, most certainly. No time to rest.
I can't remember a week that sports medicine's been more in the spotlight than the last week we just went through. I mean, in a 2-day period there at the end of the NBA Finals with really the whole world watching, there were a couple really tough decisions. And there was another one the other night I was just going to use to highlight a point with the Indians. So, we talk about it, and sports medicine's involvement at sporting events and what are some of the jobs and roles and things that we have. Looks like a pretty easy job and things, but they had some really tough decisions to make at the end of the NBA Finals, and we got a chance, I think, last week to talk a little about the decision on the Kevin Durant injury and returning him to play. And wow, there's a lot of fire going on about that one. So one of the big roles or jobs of sports medicine is return to play. And when can athletes return to play? And those decisions made in the clinic sometimes in a timely setting, but sometimes those decisions have to be made on the field, on the court, and those are not always the easiest. And there's a lot of experience and knowledge and things that go into what kinds of injuries they are, and then even trying to make decisions prognostically about what kind of risk and what's the risk-benefit ratio to make. And especially those decisions on the field or on the court can be difficult because you don't have the luxury of a lot of time, a lot of opportunity to call a bunch of consultants to help you make the decision, a lot of imaging tests to make those kinds of decisions. So, we talked a little bit about, wow, that was really a big one, of the three I was going to highlight today. On the issue of Kevin Durant, we don't know the specific injury, but we know he had an injury, and we know it probably was one that could predispose to worsening injury. And we know the worst injury of all, an Achilles rupture, is really a big deal for an athlete in an explosive sport. And so a lot of criticism has come down about him playing in that Game 5 and him being at risk and him tearing and rupturing his Achilles and ultimately last week going on to surgery. So that was a pretty hot decision-making issue, and I think it kind of highlights some of what sports medicine gets in the middle of sometimes in trying to make these decisions.
The big thing I've heard about this too, Joe, are the team doctors are really coming under fire with the Golden State Warriors, and I don't know if that's necessarily fair. I'm not in that arena, but I've heard a lot of people pointing the fingers at them.
There sure have. That's what I mean about it's really hot in the kitchen now for those guys because there's really a lot of national criticism. And again, much of it a little bit unfair even because we don't know the extent and the detail of the original injury and of the healing. We try to gather as much objective information when we make those decisions, when we have time in the clinic. Now, contrast that, Ray, to the next game, the final game of the series, ultimately, with the injury with Klay Thompson. And so we saw Klay Thompson go down. We saw him literally jog and run back through the tunnel and shoot a couple free throws, and make them, by the way, go back on defense and tell everybody he was perfectly fine and wanted to continue to play. And we saw that the medical team insist on taking him back and evaluating him, and in that evaluation process, determining that he had a more significant knee injury, and ultimately within a few days of that, an ACL that will need to be fixed, and again will be a significant time missed by Klay Thompson. But you could see, I believe, that in a high school game or in another setting where the athletic trainer's there, maybe doctors aren't at every high school basketball game or grade school game or even some college games, athletic trainers are there making these decisions. How you could, he waved the medical team off. He wanted to continue to play. How you could pretty easily say, hey, he made the free throws, he looks like he's jogging okay, and allow him to continue to play. And what was really a misconception there that I want to make a point of is a lot of people think when somebody tears an ACL that it's kind of like, oh my gosh, the person, got shot. The leg is, worthless. They can't do anything. They can't even bear weight on it. And I think that Klay Thompson really kind of showed, no, people can jog and run on these things. one of the concepts with a torn ACL is there are other secondary restraints, we call them. The quad in front, the hamstring in back, the other three ligaments that can give people some degree of stability to be able to do some sports-specific things, particularly in really well-conditioned athletes. And it can be a fooler that, hey, the knee is pretty stable without doing an examination. And even if you're not experienced, that examination sometimes is not easy to do, back in the training room where they made the ultimate decision that he could not come back in that game. And I would say to you that most people would say that probably affected the outcome of the game. It was a very big decision that they made there. And so a lot of people are surprised to hear that athletes can go on and play, and they come to see us, and they've played a couple of games or been through a few practices and issues like that, even after they've ruptured or torn an ACL.
Joe, I know it's case to case and it's X-ray to X-ray and human to human, but years ago, an ACL was a year and a half recovery before you could get out, and they would always say 2 years till you're back full strength. Where are we at on an average timetable now on the recovery of an ACL injury?
Yeah, that does wax and wane. You're absolutely right on that. And so a year is what we told people. Again, you know that I have I have some historical perspective being in the field a long time. Yeah, early on when that procedure was getting better in the late 80s and 90s, but we were still telling people to reconstruct a new ligament in the knee was pretty much 12 months. And then we really started to try to shave that time down through better rehab techniques and some better surgical techniques, and people were pushing it to in the range of 6 months. And then we saw through research, sorry to be a broken record, but often it's research that tells us the answers. We were having a lot of re-tears or tear on the other side, and that was concerning to us in sports medicine. That number went from single digits up into, well near the range of maybe 20% or so of people with re-tears or tears on the other side. And so that time now has been pushed back, and most athletes we tell now 9 to 12 months. In professional athletes, do we see them push that envelope a little bit more? But 9 to 12 months and moving back towards that year that we were using as a benchmark 20 years ago. So that is something that has moved around a little bit. But the tough part is there's no MRI in the training room at LS School or at Firestone High School when we're trying to make these decisions. You have to make a clinical decision. You have to know what the risk-benefit ratio of putting an athlete back out there is when you make these decisions. And I'm just submitting to you, if you saw a guy like Klay Thompson run back out on the court, you can see that you could have easily just said, or he would have waved off the medical team. He could have continued to play in that game. What may have happened, Ray, later is, and what I did here, was some of the swelling started to come into it. The ACL has a lot of blood vessels, so one of the things is it'll swell and people start being unable to bend and straighten the knee as much, and that becomes more obvious and they can't push off and they limp more. But early on, you could see how you could be fooled, and so I'd use that as a second index case. Maybe a third one, and this is not as dramatic, but for Cleveland sport fan, I don't know if you were watching the game for the return of, and I just really enjoy baseball the way you do, is of Mike Clevenger the other night when he went down.
Yeah.
Did you happen to see that?
I did. He went down, and boy, I was fearful that something happened again, but luckily he's okay.
So coming off of an injury like Clev had, and then he goes down and he's on the ground in obvious pain and doesn't want to move, and the training staff comes up again. The certified athletic trainers are awesome. That evaluation was done by the trainer. Of course, I watched it very carefully, and in the heat of 86 degrees, where our team hasn't been playing a lot, and in a guy who's just getting back to his first outing, obviously my strong hope was that was going to be a clear-cut cramp and not something worse. But you could see easily on return to play how you could have said, hey, I need to take this guy back in the training room and examine him and make sure he didn't tear a calf muscle. There's that calf again. He was holding his calf muscle, and so there's some things that tell us that this looks most like a cramp, but I'm sure the training staff and everybody for the first few pitches in the inning or so after Clevenger went back out there a little bit concerned about returning him early on. And so these, I think, are three examples of things that we have to know that people are wondering, hey, what are those sports medicine people doing out there? Is you have to have kind of a knowledge base of what these injuries are and how they occur, You have to have a knowledge base of what's the worst thing that could happen prognostically if these people are injured, and then you have to really make the ultimate decision of the risk-benefit ratio. Is it reasonable to let this person play or not?
Yeah. All right, Joe. Great information, good insight to all sorts of areas in sports medicine. Always appreciate the time. We'll catch up with you again next Wednesday.
Okay, Ray. Have a great week.
You too. Dr. Joe Congeni, Akron Children's Hospital, joining us here on the Ray Horner Morning Show.